Welcome to Clinicians Roundtable on ReachMD. Today, Dr. Natalia Usoltseva, a primary care provider at University of Washington Medicine in Seattle, will be talking about her experience with shared decision-making tools for colorectal cancer screening. Here she is now.
Shared decision-making can be very challenging and time-constrained visits. So how did we incorporate those conversations into the routine care? So overall, the time constraining, that's a very real concept and very real concern for us. So as we all know, primary care visits are already packed, feeling very rushed, and we have so many points that we need to touch before we actually jump into why patient is here. So anything on top of it needs to be very practical, and the providers needs to bite on it as well. So what we tried to do, we created shared decision-making aid. And that actually helped us to rely on some kind of standardized tool versus expecting the providers to have a long, open-end conversations that will deviate from provider to provider. This shared decision-making tool actually covered the things like how often this test needs to be done, what preparation is needed, is it invasive or not, what happens if results are abnormal. And we strategically placed it in each exam room in our organization across all of our clinics. And while the patient was waiting in a room, they already have started the reading on its own. And by the time the provider will come, they will have some understanding and they're ready for the discussion. And usually they already have questions to us. And that helps us to actually have this conversation to be focused and efficient because you're not starting from the scratch. You have a visual aid that you guide your patient through the consistent framework, and it can be done in a few minutes with a routine visit. And we also embedded in our system supporting documents to help provider quickly assess whether this patient in average risk or the high risk. Because this is very important in terms of what type of the test you're supposed to choose. Because if patient is a high risk, then they need to have a colonoscopy, and the stool-based approach is not appropriate for those type of the patient. And with the time, it became part of the normal right of the care. So providers became more comfortable with this conversation. They kind of developed their own script in the brain. And because the message was always standardized, it reduced variability and uncertainty. I always tell that the best test for the cancer screening is the one that had been done. And it's very important that when we discuss those screening options for the colorectal cancer screening, we align the ordering test with the preference of the patients, because this is most likely that they will complete the test that they prefer to. They understand the meaning of this test. And it means that you have less conversations, less delay, and less time will be spent tracking down those incomplete screening later.
That was Dr. Natalia Usoltseva discussing how her practice integrated shared decision-making tools for colorectal cancer screening. To access this and other episodes in our series, visit Clinicians Roundtable on ReachMD.com, where you can be part of the knowledge. Thanks for listening.